fully vaccinated. Still a long way to go. Narok County is ranked among the top 10 tuberculosis high burden counties in the country, with over 1,000 people infected with the infectious disease. Since the outbreak of the COVID-19 pandemic in March of 2020, TB patients were worried about contracting COVID-19 in hospital. Therefore, they failed to collect their drugs, and because, like TB, coughing is one of the symptoms of COVID-19, patients stopped going to hospital for fear of stigma or being taken to COVID-19 isolation centers. Rose Wangoi now brings us the story of Lilian Naserian, a TB champion who goes door to door, raising awareness on TB and the need to seek medical attention.
Ledama Tande is a frequent visitor at Megwara Dispensary in Narok West. He was diagnosed with tuberculosis in December 2020. Ledama says he realized that something was wrong with his health when he started experiencing a recurring cough and other symptoms that he assumed would disappear.
Nilikuwa na hiyo shida tu ya kufua. Hiyo ugonjwa ulianza tu kimjezo tu na kuoa, nasikia uchungu kabisa. Nasema tu ili niende hospitali nione. Nimeenda hospitali mara mingi. Napewa tu dawa nikaona tu asisikii.
He went back to hospital and a sample of sputum was taken for testing, and unfortunately it came back positive for TB.
Baada ya wiki mbili nikaitwa. Nikakuja kuchukua, nikaambiwa utachukua dawa ya TB. Nikaanza kukunywa hiyo dawa. Nikasikia tu mabadiliko yamekuwa sawa.
2 months later, his nephew, who he lives with, started coughing, sweating at night, and experiencing difficulty in breathing.
Sasa nikajaribu kupeleka hospitali, kasemekana tu iko na hiyo ugonjwa, ni hiyo ugonjwa ndio ako nayo. Akaendelea kunywa dawa. Sasa hii ni kama mwezi mmoja ndio naelekea kumaliza.
Ledama is still under medication.
Na niko na kikombe yangu ya chai. Nikimaliza na kijiko yangu niko naye. Ukimaliza hizi madawa, unaweza kuja na familia yako yote. Tupime, tuone venye itakuwa.
Not so far away, we meet Esther Ololonyo. In 2017, she was the one taking care of her sick husband who had TB. Esther says she first had fever symptoms that led to vomiting and coughing. Despite her husband's advice to seek medical help, Esther opted for daily over-the-counter medication. She visited the nearest health center only when her health deteriorated.
I lost weight and experienced difficulty in breathing. I decided to visit the hospital. After screening, the doctors told me that I had tuberculosis. I was shocked.
Esther was immediately put on treatment. She took the TB drugs for 6 months before she was declared TB-free.
I'm very happy. My health has really improved.
Kenya is among the countries with the highest TB burden in the world, with an estimated 558 people in every 100,000 infected. TB is also the 4th leading cause of death in Kenya, claiming 53,000 lives each year. In 2019, health centers reported and treated 86,504 cases, of which about 10% were children. TB is a potentially serious infectious bacterial disease that mainly affects the lungs and which is spread when an infected person coughs or sneezes. Here in Siana Ward, Narok West, Ledama is among 64 patients who have been infected with tuberculosis. Narok is ranked among the top 10 TB high burden counties in the country. The county has 1,282 people battling the infectious disease.
When we assess them doing the physical examination, most of them do not have PCG scar. That tells you that when they were young, they were not immunized against TB. So that has got a correlation between the high cases of TB in Siana Ward.
Persons with active TB have symptoms which include excessive coughing, sometimes with blood, chest pain, general weakness, lack of appetite, and weight loss. Lilian Naserian is a TB champion in Siana Ward. She has been supporting TB programs to enable patients access medication encouraging them to adhere to medication and doctors' advice.
A lot of people from my village are not educated, and therefore they miss a lot of information. There is a huge number of TB patients in my village. I have also encountered a number of deaths. We teach the community to understand the symptoms of tuberculosis and the importance of taking the patient to hospital and making sure that they complete medication. We also teach them how to treat the person who has tuberculosis with respect.
But TB is still a highly stigmatized and a dreaded disease within the community.
Some people believe that when you cough for more than a week and you're treated and you're still coughing, they believe now maybe it's a curse. They choose to use the herbal medicine because when they go to the clinics and pick medications and other people see them using TB medicine, they will start isolating them.
When COVID-19 struck last year, the fear of contracting COVID-19 discouraged many from visiting health facilities even if they display TB symptoms.
Most people think when they cough, it is associated with the corona. And in case we have found it to be corona positive, we might be taken to the isolation wards. So that has made most of the patients shy away.
People are living far from health centers, and you find that sometimes they don't go to hospital as it should be. So we have, with a partnership with the medical health officers, we visit them and ensure that they're taking medicines as it is supposed to be.
According to health officials, the manyatas are poorly ventilated, which makes it easy for TB to spread.
Houses must have enough ventilation. At the same time, you have told them nutrition matters a lot.
A person ill with TB, says the World Health Organization, can affect 10 to 15 people. This pool of missed TB cases continue to fuel the spread of the disease.
Having 20 cases of TB in a facility, that tells you that there are so many cases at the community level. Mass immunization to our newborns within 2 weeks. They must get the PCG vaccine.
Despite TB diagnosis and treatment being offered free of charge in public facilities, not all that are infected with TB are reached and therefore do not receive the care they need. The normal TB is treated for 6 months, while the multi-drug resistant TB takes 2 years to complete and has been associated with frequent and severe side effects.
We don't have a laboratory, so we must send our sputums to Narok referral. Even by the time we get the results from referral, it takes a bit of time. And on the other hand, the patient is suffering.
The good news is that there is some evidence that mask wearing is reducing the spread of respiratory illnesses such as TB, but masks do not replace the need to identify, test, and treat all cases of TB.
We ought to educate them to differentiate between TB and the corona. And we ought to educate them on how to control the corona and the TB.
Kenya also embraced the goal of ending TB by 2030 and is making significant progress despite formidable challenges posed by the COVID-19 pandemic. Sensitizing people on preventive measures and treatment of TB has greatly reduced the spread of the disease in the community, hence saving lives. And it is the efforts of TB champions like